So up next, we have Dr. Chris Hogrefe. So he's going to be joining us to speak about his work with professional athletes. He is a clinical professor at the University of Iowa and practices sports medicine at Northwestern Medicine. He's the head team physician for the Chicago Cubs and has been working with the team since 2014. And when he's not working, he enjoys spending his time with his wife and their 413 pairs of Air Jordans, which we could see a couple there. So, Chris, take it away.
Hello, everyone. Can you hear me okay? All right. Now, let's get it started. Thank you all. Thank you, Dr. Ebinger, for calling to harass me. I appreciate that. I look forward to that text message in 6 or 7 months when you write back. In any event, it is an honor to be invited to speak, and some of what I'll touch on will be intuitive. Some of it will be stuff I learned along the way, but hopefully uh, share some insights into what it's like to take care of professional athletes on a day in and day out basis. Anyone who's had to suffer through me speaking in the past knows that I always start with music, and that's difficult to do on Zoom, but we'll give it a shot. So we'll start. And one never really knows whether you heard any of that. Something tells me you may not have, but that was The Verve, who had a hit song in the 90s called Bittersweet Symphony, and one of their lesser known songs was called Lucky Man. And I picked that one because I have very fortunate to be where I'm at, and that's not lost on me. So I don't have any conflicts of interest. And here's what I'm going to touch on. So when it comes to professional athletes, I'm going to touch on why emergency medicine physicians are perfectly trained for this role. Well, maybe not perfectly, but close. Talk about some of the knowledge and training gaps that we have in our primary training that are paramount to address in fellowship, and it turns out long after. Cover some perks of the job, some of the drawbacks, and you probably already did laugh at me because of the snafu with PowerPoint to start. But if at some point in time you laugh during the presentation, then we will have succeeded overall. Um, So for those of you who don't know me, that motto at the top pretty well summarizes my mantra. So I try as hard as I can at everything, and if you beat me, kudos to you, but you're going to work to do it. And that was from Steve Prefontaine, who was one of the preeminent long distance runners in the United States in the 70s and 80s until he passed away. This is me with my shoe collection in 2012. And since then, it's gotten a little bit bigger. I'll mention that a little bit later, but this actually is a little more relevant than you may think. So over the course of time, particularly since moving to Chicago, I've had some blessed experiences. That was actually my footage from my cell phone when the Blackhawks won the Stanley Cup last, and I was covering the ice or on ice physician. Didn't work directly with the team, but still had a great experience in that capacity, and have worked with the NFL to cover the visiting teams and their players when they come to Chicago. But my role primarily right now is to take care of the Chicago Cubs. Now, I will qualify this. I'm not the head team physician. That responsibility falls to Dr. Grislow, who's our head team orthopedist. I'm the head primary care physician, so I just don't want to misrepresent my title in any way. But I moved to Chicago specifically for this job in 2014, and have been blessed not to have been fired since then. 3 took over the primary care responsibilities for the team. And that's a little bit bigger job than it might seem just in title. And we'll touch on that as part of the nuances of this. But I to see thousands on here. That said, the topic is interesting. some college athletes make more than many professional athletes. And so a lot of what I do is stuff that I may have done when I was working at the University of Iowa in sports medicine. So name, image, and likeness as it is, there are players in college football right now making $5 to $7 million a year. So some of this stuff will apply at that level too. I don't know of any high school athletes making that kind of money, but um, that plays a role in expectations and agents and all of those things. So first, why are we really well suited for this job? Now, this is the sort of typical patient will lead at night in emergency department, but it's relevant because these types of things in the emergency department we may not necessarily want to see, but they also happen in professional athletes, and they're harder to punt to a resident when you're taking care of a professional athlete. So for us, like if Kevin Love is on the floor and he dislocates his shoulder, we're pretty well suited to handle that. Some people will say, hey, orthopedics can handle that too. And I'll say that we're just as well trained and may have reduced more shoulders acutely than many orthopedic surgeons. Not taking a shot at orthopedic surgery in the least bit, but this is well in our wheelhouse. So was this. So this is the Kevin Ware comes down and snaps his tibia on the court, right? So yes, he will need an orthopedic surgeon. No, he will not get one to operate on him on the court and stabilizing that patient, his leg, his cardiovascular status, and all those other things is we're better trained for this than anyone. And if you haven't seen that picture, it was pretty impressive. Now, even if you wanted to make an argument, orthopedic surgeons are well suited to handle those things, that's fair. But stuff like this, which doesn't happen often, but it can, and it happened to the Cubs. So that's Tyler Colvin running down the third baseline who got hit by a broken bat square in his left anterior chest that caused a pneumothorax. So obviously, right in our wheelhouse to stabilize, manage, treat as needed in the clubhouse and get to the appropriate resources immediately. Same thing happened in the G League associated with the NBA a few years ago. Down in the corner, you'll see a player, Zeke Upshaw, who's not moving and laying face down. And well, I'm not commenting on the care then providers would have already had that patient over with an AED on and partially resuscitated, or at least on the way to return a spontaneous circulation. So for professional athletes, just like high school athletes do too, just on a bigger scale with more attention. This is obviously Corey Stringer, who passed away from heat stroke, and I know that. And in my capacity, like I don't just take care of professional athletes, I take care of the umpires, I take care of the visiting team and their families, and sometimes referees collapse on the floor. And I don't know if you remember this story from a couple of years ago, but this referee had a syncopal episode on the floor, and it turns out he had a large saddle pulmonary embolism. And again, there isn't another specialty in medicine better suited to handle these types of things. Now, aside from that, which seems fairly obvious, it may not be necessarily only germane to professional athletes. What I have found in my role with dealing with colleagues and specifically consulting services, and is there any better specialty in the hospital to deal with consulting services than emergency medicine? I can't imagine that there is. Tricky part is this, for me anyway, in an academic medical center at the University of Iowa, it's when do you call a consultant because you're at the academic center and you're supposed to because those resources are available, and when do you actually absolutely need to? And that threshold is a little different in professional athletes because if you don't get it right immediately or get them to the right specialists immediately, they will go somewhere else. And so it's something that you have to keep in mind. So you obviously want to do everything that you can, but if it's even slightly outside of your wheelhouse, there's no shame in getting experts involved in the field, and they are often very gracious and willing to help. Okay. Part of this stems from chronic medical conditions that, quite frankly, we don't manage all that much. So we had a player in the last year that will remain nameless, but came to our team and had a very complicated case of inflammatory bowel disease. hadn't been managed well, was thought to be affecting his performance. And before we acquired the player, I was told about the condition and was told that I needed to get it under control immediately upon his arrival, which was a tall order since it had been going on for more than a year and hadn't really been all that well controlled. So that's obviously outside of what I would manage in the emergency department, just like you, but figuring out how to solve that, who to call, navigating that system, etc. We're very well suited to do that, and it's a skill that has benefited me quite a bit over the years. And like I suggested earlier, the key here is not just knowing who to consult, but when to do it. And sometimes that's earlier rather than later, requires a conversation that says, I think we have this under control. I'm happy to do it if you'd like, but here's the plan moving forward. And that's a skill that we develop in the emergency department, one that comes in handy, particularly with professional athletes. Shifting gears is a valuable skill as well. This comes in quite handy in the emergency department. 1 minute I'll be in spring training doing physicals, which I'm about to leave for in less than a week. And you'll be humming along doing 4 to 5 physicals an hour. And then a coach will come in after shutting his hand in a car door with part of it hanging off, the nail avulsed, and clearly an open fracture there. So being able to quickly shift gears, get the C-arm, get your x-ray, fix the nail, put the finger back on, splint it all before your boss comes into the training room because he would have preferred to send him to the emergency department. That ability to handle multiple things at the same time, but be able to ramp it up and dial it back at the same time has proven to be quite handy over the course of the last 14 years in particular. When it comes to this topic, it's hard because I think we all feel some pressure, regardless of whether it's a 12-year-old athlete in middle school that you're covering an event for, or a high school, college age kid. Someone's a pressure when you're taking care of professional athletes. Is, but there isn't a spike. Different, these individuals tend to have an increased or perceived increased importance, whether that's because they're famous or because they make a ton of money or whatever it is, but they're not more important than anyone else. I think you all know that, but the pressure put on externally by various people, whether it's the front office or colleagues, the players themselves sometimes, there's a lot of perception that things are more emergent than they necessarily would be. So handling those things right in our wheelhouse as well. I will say that the time pressures are real. Getting people back faster, getting imaging done faster, getting an answer faster, seeing all that play out to a positive extent on the field, all those pressures are quite real. And I will feel them from time to time. But at the end of the day, just remember that the anatomy and physiology are basically the same. They're pushed to different limits by professional athletes, and they're taxed more, both with regard to the amount of strain and the repetitiveness, etc. But really, body works the same way. They're just pushing it to a level that many of us never experience.
Look out! Oh, Patty got hit. Oh, man. Brandon calling for Joe and Nick Frangella. Oh, man. Coach PJ Mainville as well. Normally up around the head, the hitter will turn away and the ball will get helmet. That did not, I don't believe it.
So I've stood over airway and I've been intubating patients when I see the surgeon's blade come through their cricothyroid membrane, wondering what the hell's happening. So I've been in pressure in the emergency department and it never has particularly bothered me. This day was a little unsettling for me, and it really probably shouldn't have been. But as I reflect on it, I just happened to be in Milwaukee that day because it's fairly close to where we live, and the Cubs were playing the Brewers, and I was sitting in the stands and I watched this happen. And I then walked down to the clubhouse, which is a short walk in Milwaukee, and stood in the dugout because the general rule is the home team in Major League Baseball takes care of the visiting team. And I didn't want to step on anyone's toes. And I know the Milwaukee medical crew very well. They're very, very good at their job. But I didn't want to step on any toes until one of the coaches looked and said, "Don't you think you should be out there?" I was like, "Well, I probably know the player better than anyone else." And standing on a field in front of 40 something thousand people while everybody waits for you to make a decision, which is important, but not a life or death decision like managing an airway, etc. I felt an unusual pressure in that situation. And maybe it's the rules of the game where you take a player out and you can't come back in, or there's long-term consequences, etc. I get all that stuff, but for whatever reason, 40,000 people in the building and however many hundreds of thousands at home watching, there was pressure. I admittedly took all the time I needed to make a decision and got through it, I think, well. Determined that this player didn't have a concussion, left him in the game. The very next pitch, he stole second base, same at bat. He scored on a hit to the outfield. He walked into the clubhouse and he looked at me and he said, "I don't feel so well." And of course, he had a concussion, and that ended his season actually. And so the decision in retrospect, maybe it was not correct, but given the information I had, that was the one that was made. And it was that I don't think it was impacted by the external pressures, but they are quite real. And another pressure that's quite real that you don't feel a lot of other places is evaluating an unnamed player in a physical for what turns out to be the 14th largest contract AV wise in the history of Major League Baseball. I don't think that I'm any more or less detail oriented when I evaluate this player versus any other player. But there is some pressure there. You're reminded of that pressure when they hand you a stack of insurance paperwork that you have to complete so that there can be supplemental policies on a contract that large. But that pressure is real, and it's not necessarily one that you feel in that way all the time. And this pressure is both good and bad. So that's 2016, and that's Theo Epstein, Jed Hoyer, and Jason McLeod. That's the front office for the Cubs when we won the World Series. And those gentlemen, I don't know if they would agree, but they're friends to this day. And they are good people, but their perspective on what should be done or the questions that need to be answered and mine from a medical perspective don't always match up. So within the last week, I was asked to medically clear a player who had been he wasn't pronounced, but he was clinically dead in the bullpen after having a cardiac arrest and needing an AED and several rounds of epi. And that player eventually got a life vest followed by an ICD, and the team wanted me to medically clear him. And I expressed some reservation with that decision, given that no one could tell me why he actually went into a VFib arrest. And that conversation went surprisingly well when I explained the potential issues. But they're looking at things from what can the person do on the field, and I'm looking at them for what is the risk to the player and the team. And on some level, the training staff, who half of the year will be taking care of these people in cities that I'm not in because I don't travel with the team all the time. So those competing interests create pressures that you don't always feel in other roles or capacities. Other skill sets besides pressure that lead us to do well, right? We compartmentalize very well. We can walk into one room and deal with a runny nose, and the patient in the next room can have a stroke. And we are able to not just shift gears, but we're able to deal with the one part of a patient in their presentation while instantaneously dealing with another one. We can have a rough encounter where perhaps we lose a patient, and we'll always carry that and on some level, and perhaps even during the shift, but we're able to compartmentalize that a bit and move on to take care of other patients. And compartmentalization in professional sports is a little bit different, but my role in taking care of the Dominican team and what they require and need versus the rookie league team in Arizona or the team in Chicago, those things are different, operate at different speeds, have different resources, and being able to separate them with the same underlying excellent treatment goals in mind is helpful, because you have to recognize what's happening in different spots and how you can get that accomplished. The inherent underlying premise there was that I'm not just taking care of the professional athletes in Chicago. I'm helping to oversee, with the excellent help of the affiliate physicians, but I'm technically overseeing Des Moines, South Bend, Tennessee, Myrtle Beach, the Dominican, and Arizona all at the same time. So it's a lot more than just the 26 players on the active roster in Chicago. Now, with that said, there's some stuff that as emergency physicians we don't do particularly well. At least I don't do particularly well, that come up frequently when caring for professional athletes. So the medicine part is a big one, and long-term conditions are not my strong suit. And if they are yours, I am super impressed because I still don't know that I do this perfectly, and I'm improving as we go. But asthma, high blood pressure, ADHD, thyroid issues, you name it. And there are things that we see exacerbations of, but these are common occurrences and common things that need to be managed in professional athletes. And for many professional athletes, I am viewed as their primary care doctor. They call me when they need something and don't have anyone else to lean on. For me, the only reason that I can do this on any reasonable level is the guy that you see on the screen. His name's Dr. Britt Markison, and he was the co-fellow with me at the University of Iowa when we did fellowship. And he is family medicine trained, and he taught me, no disrespect to any of the faculty at the University of Iowa, I learned as much from Britt as I did anyone else. And he gave me the perspective of managing some of these things that I hadn't even thought about. I walked into sports medicine wanting and needing to boast and improve my orthopedic knowledge set and management of those things. And as it became clear that a desire of mine was to be a team physician, I needed to manage way more than that. And he's one of the people who helped with that. So one of the things in fellowship, if you don't have a strong background in this or don't feel comfortable with it, don't run away from it, run toward it, because it's the thing that's going to help you the most moving forward. And once you get done, you're still not going to know everything. I remember my first week of clinic at the University of Iowa after fellowship, I saw no fewer than 5 patients where I walked out of the room and I said, I have no idea what the hell that is. Absolutely none. And that is not uncommon. Depending on where you work, you're going to see all kinds of stuff where you're like, I haven't seen that, don't even know where to begin. So when it comes up, call me, call Dr. Ebinger, call Will Ding, call Dr. Waterbrook, call Dr. Champas. If you have people you know that you respect that have a knowledge base, and I probably don't fit any of those categories, but nonetheless, use those colleagues and experts. They are here to help, and they will. But there are things you're going to see you don't have any idea what it is, particularly in the chronic medical world. That's fine. That's how you learn and grow. We are not concierge doctors by training in emergency medicine, and I am very much a concierge doctor right now, which I am not complaining about. I signed up for it, but I am on call all the time. It literally does not matter where I am, what I'm doing. It doesn't matter. Took my family on vacation at the end of December, and it didn't matter. And I am not complaining, but you have to accept that fact. And it's not a mindset that we are used to, but it's a reality. We find ourselves on an island, and maybe on some level we feel like we're on an island in the emergency department because nobody wants to take our patients and they're always boarding and nobody can really understand our perspective on things, etc. So I get that, but this island's a little bit different. When I go to spring training, there's lots of people there to help me, and I'm not complaining whatsoever. There's great physicians in Arizona that help us out and all of those things. But I still feel like I'm on an island. I'm away from my family. I'm away from hospital. I'm in a state where I have a license, but I don't actually otherwise practice in Arizona. And so me setting up relationships with Banner or the Mayo Clinic in Scottsdale or whatever it is, those are de novo relationships. And building the relationships with the colleagues that we consult or help cover games, etc. You really start out on an island, and it's an odd feeling because in the emergency department, you can pick up the phone, you can call anybody, and they're going to have to come, or at least they're going to have to talk to you if they're not coming. But it's a much different feeling when you're this far away from home trying to practice medicine, and the team thinks everything's going to be the same because you're there, but you realize in the background it's not really that way. And this one's really tough because in the emergency department, it's not usually the case that a patient comes in, they have an aortic dissection, they don't like what you tell them about they need a CT scan and to see a cardiothoracic surgeon, so they walk down the street to a next emergency department. That doesn't often happen. I guess sometimes it does. But in professional athlete world, you have competing interests. You have the player's perception. You have an agent involved. You may have a second cousin removed who saw a doctor on TV once, so has an opinion, whatever it is. But if I give it what I think is a very sound opinion based on my assessment, whether it's medical or orthopedic related, and they don't like it, they will go talk to somebody else. And you've got to be willing to get over that because it happens all the time. A lot of the surgeons that you see that do the surgeries that make it on ESPN or other news outlets, they're wonderful surgeons. I am not taking anything away from them. But there are other wonderful surgeons who are just as skilled and they don't do as many of those surgeries because it's driven by other people. So they get second opinions all the time. It's their right according to the collective bargaining agreement, and I don't stop them and I try to help them as much as possible get those opinions, but you just can't take it personally because it's not you. And then this is an issue again, so it's not the same slide, but compartmentalization can also be a problem. So you kind of separate yourself from things and you either get busy or the situation changes or you miss of the headed aside training and you have things that you need to do. So you set that aside and you don't get back to it quite as soon as you need to. Compartmentalization can be good, but it can also create issues too. So you just have to be cognizant of that. For us, we never have a problem ordering tests in the emergency department, and that's really not any different. But your conversations about those tests and their outcomes, those ones need to be tempered a little bit. In the emergency department, we get a test. Sometimes I guess we wait for radiology to read the imaging, for instance, but oftentimes we can read it and we go tell them. That is not the best thing to do necessarily in Major League Baseball. A hypothetical story about a player who took an awkward step to first base and injured his knee, but was thought to be okay. And the front office was told that he definitely didn't tear his ACL. And then the MRI, of course, shows that he tore his ACL. That didn't go well for anyone. So saving your predictions and saying, we should get an MRI to look for an ACL tear, that's probably sufficient, right? No one's going to push back on you in that one. And you don't have to be a hero by predicting it ahead of time, because if you mispredict it, everybody's going to be in trouble. Now, before we finish up, some perks of the job. So for me, I am paid to watch what I love to do. I lived in Iowa City. My wife and I had season tickets to the Cubs. We would drive 4 hours each way to go watch games. Now they pay me to sit in the stands and take care of them while watching baseball. That's pretty great. And if you love baseball, watching it at any level is fun, but rooting for your favorite team while getting to take care of them is kind of the next level stuff. I have personally like long lasting connections. The Cubs convention was last weekend, and I cannot tell you the number of text messages or calls I got from players back in town saying hello or stopping to say hi and having a conversation when I was at the convention. And that's not a flex. I'm just like, it's a really meaningful part of the job. This is a pair of Air Jordan 7s from Dexter Fowler. They're his player edition shoes. And I didn't ask for them. I would never do that. Like, that's a cardinal sin. But I was not allowed to leave the clubhouse until I took those with me. Like, he literally forced me to do it, and I still text and talk to Dexter every now and again till this day. And those relationships are meaningful. It really makes the job that much more enjoyable because I do get to know these players on a different level. And for me, it's really cool because I know that the players my kids root for as people they see on TV are really good people. And you may just get to travel to see the world. So getting to take care of professional athletes has somehow put me in the good graces of Major League Baseball and the World Baseball Classic. So I've got to cover the World Baseball Classic in 2017. And they sent me to Germany in 2022. which was a cool experience to say the least. Baseball is a very different animal in Germany. I've got to go to London and take my wife, and I got to go to Tokyo this past year. So all excellent experiences that I don't know that I ever would have made it to Tokyo. It wasn't on my bucket list, but I'm glad I got to go. I'm really glad I got to go in a chartered jet with a full row to myself, because I don't know that I could do it in what I would book for myself, which would be like lower class, cheapest economy ticket possible. And obviously, like the perks of this job in terms of sharing it with those that made it possible, the amount of sacrifice my family has made so that I could do this is not subtle, and my wife in particular, but getting to share it with them and watching them enjoy it is beyond cool. Especially when your youngest guy waits in line to get an autograph from Anthony Rizzo, doesn't buck the line, doesn't say my dad's the doctor, doesn't do any of that stuff, waits in line for his hour and a half, and he gets a fist bump because Anthony immediately recognized who he was. So Anthony's a great guy, but for him to recognize him and put that kind of effort emotionally into it, that's something that I have never forgot, neither has my wife. And I think my little guy, who's now 12, still remembers it. And this is a day I won't ever forget. This is my favorite picture in the world that displays my life, career, and family balance. This is my son at the time, 8, on the field after the World Series of Game 7. And just the joy on his face and everything that went with it was super cool. And it'll hit you, whether it has now, it will in the future. But that same kid is now on the right, is a senior in high school, who's about to go off to college. So it was 9.5 years ago. And he'll be going off to Creighton, but that time flies, and those memories he still remembers that day, and I won't forget it. So it's a pretty cool perk of the job. But not every job is perfect. For every player, there's a coach. And for every coach, there's a staff member, family member, friend, cousin, uncle, whatever. And they're all coming for you, brother. Especially when you're on that island in spring training, you are a sitting duck. And every single person who can will come and ask for advice. And it's not a problem. I love to help, but I also know that I have all of these other things going on with lab tests, physicals, EKGs, supplementary testing, covering the games, all that stuff is going on. So you have to recognize that the waiting room never ends when you're taking care of a professional team, because you're not taking care of just the players, you're taking care of everybody around them. And that's okay. You just have to be aware of it. Sometimes you have to be aware of the fact that you're taking care of other people that you wouldn't even expect. And so this was opening day 2 years ago. And if you look under that giant American flag, that person who is kneeling down with a black sweater and gray slacks, that's me. That's me tending to Bruce, who didn't get a proper screening exam before he carried the flag out because he had a syncopal episode and laid there motionless while everyone else sang the national anthem. So you can imagine myself and my colleague, Dr. Grislow, just meandering through the national anthem line as we ran out under the flag. Fortunately, Bruce was okay, but these things happen. The other thing that while you get to see the world, you also get to be the only doctor on the plane that fixes anything. So it's not bad, but you have to be prepared for it mentally. And when you're on a 14-hour flight to Tokyo, something's going to happen. You just have to be ready for it. So it's not necessarily sports medicine. Maybe it's aero medicine or travel medicine, but you have to be prepared to deal with it because it's in your house too. The other part of it is the trip to Tokyo, for instance, was great. It was fantastic. Wouldn't trade it for anything in the world. But while my wife got to have fun, I kept waiting for somebody so I could deal with stuff. And it happened. And that's fine. It's part of the job. But you're going for a little bit of leisure and a lot of work. And you have to keep that in mind. So again, it sounds like a first world problem, and I'm not complaining, but it's a little different than going to watch the games because you're going to work. And again, this too isn't complaining, but I have about a 2 week stretch in my world where I could potentially take my family on vacation between their high school and event schedules, in my work schedule, in the team schedule. There's really a short period of time. And when that period of time is still free agent, getting called, reviewing things, etc. So you have to realize that you don't have full control over your the insurance coverage is real. The vast majority of injuries in particular in Major League Baseball will fall under workers' comp. That never even crossed my mind. And when you say it, it makes sense. But when they get injured doing their job, it's workers' comp. So that usually it isn't a big deal, but sometimes it can be. And so you have to just keep that in mind. Sometimes it changes the threshold for imaging. Sometimes it changes the threshold for follow-up, et cetera, how quickly you return to people, et cetera. And one of the things in baseball that's a little tough, the rule is that for every home game, there has to be a primary care and an orthopedic provider covering the games. Now, that doesn't mean the whole game, and sometimes one group or the other rounds, but at the end of the day, you're well trained to do emergency medicine and sports medicine. But you may not get to do the orthopedic part of sports medicine all of the time. So don't take that personally. It's a team approach. It's not that anyone doesn't think you can do it, but there are times where I could perfectly capable of handling a various orthopedic injury, but it goes to the orthopedic surgeon covering the game, and that's cool. And there are other times where I take care of it because it's on the fence and more of an emergency medicine thing. Or I'm the only one there and I'm perfectly suited to do it. But you have to get over it's not an inferiority thing, it's a teamwork thing. And I'm not going to dwell on malpractice, but it's a thing. And for me, fortunately, it's not a thing because my appointment internist who handles my malpractice, but this can be a significant issue. Like the amount of money that people are asking for. You've probably heard of the Philadelphia Eagles case, but the most poignant point on this topic for me is the surgeon who fixed Kevin Durant's Achilles tear got paid, like reimbursed like $900 for that surgery. And if it fails or he doesn't do well, he's going to get sued for $65 million. The system is crazy that way. And we can all work together to fix it. And Major League Baseball Players Association is trying to figure out creative solutions to address it. And it's going to take time, but you have to be aware of it because it hangs in the background. For me, it's irrelevant because it's not an issue, but for many, it is. Last thing I leave with some help. So I'm lucky. It's not lost on me. I blindly sort of found this and blessed, but if I can share some things, I'll do it quick. This is Dr. Steven Adams. He was the head team physician for the Cubs for over 20 years, sports medicine, emergency medicine, and internal medicine. If it wasn't for him, I wouldn't be talking to you. I wouldn't be in the position, and I don't know that I maybe even would have found my way to sports medicine. We all have mentors, people we look up to, and we stand on their shoulders. So if you don't have shoulders to stand on, make those relationships. They are one of, if not my favorite aspects of being a sports medicine physician is the relationships I've got to enjoy over the years. And pay it forward because in this picture, these are 4 Northwestern residents, 2 of whom are emergency medicine, sports medicine providers. And I know one of them was on the call earlier today. One of the other ones went into toxicology. Help others. I never would have got here without help. And I hope I have helped somebody along the way to the same extent that they have helped me. And lastly, well, almost lastly, shoot your shot. This is my second year of medical school. I sent this very email to Dr. Adams after poking around on the internet to find his email address. I can assure you that if I didn't send this email, I would not be working with the Cubs. And it was just a blind email from a second year medical student asking about how he got his job, basically looking for mentorship and guidance. And for whatever reason, he answered it. And I'm grateful that he did. But if you don't shoot your shot this way and reach out and make connections, the answer is always no. And be authentic. I was in high school, same age as my son, and you can all laugh at me. This was my Air Jordan collection then. That's totally fine with it. I'm cool with it. But this, you got to remember, this is 2000 and this was the thing. And interestingly enough, it's the thing. This is the display cabinet in my office to my left right now with my 60 most prized pairs of Air Jordans. And why do I put this up there? It is not a flex. It is if you always know who you are when there's pressure or when people put you to the test, you'll never forget who you are because it's just you. And for me, this is something I have enjoyed since I was in high school, and it hasn't changed. And I wear Air Jordans to clinic every day and to the emergency department. And do you know how many players talk to me about Air Jordans? Not because I'm liking them for them, I just like them. I can't fake this. The number of people that asked me about my shoes last Friday at the Cubs convention, I can't count on my fingers. And it's not for any other reason than it was a connection. And we bonded over that. And we had conversations and it led to more things. And I'm not saying you should go collect Air Jordans. What I am saying is whatever you're into, be you and have those conversations and let that ring true. And you'll be surprised at how far that will take you. So at the end of the day, I know it went a little bit long. Hopefully I hit on the objectives. This is my crew when we were stranded in Barbados because our nation bombed Venezuela and you could not get off the island. So kudos to them for making the most of it. If you have questions, I'll take them.
Chris, thank you so much for your talk. All right, I think Chris is actually going to be on the career panel, so let's get the career panelists up and we'll get right into the swing of things. And if any questions from that talk, we can answer it during this session as well.